The audience, good afternoon. Lotta.
Good afternoon.
You would rarely see one diplomat interviewing another diplomat. So it is my pleasure today to interview my colleague, Swedish diplomat, Lotta Sylwander, who is representing United Nations Children's Fund in Ukraine. By education, Lotta is a social anthropologist. And my first question to you is that it looks like in times of pandemics, any comprehensive emergency response team would need as a team member a social anthropologist. So tell me, what can governments, institutions, hospitals take from the knowledge and the skills a social anthropologist can bring in?
Oh, thank you. Well, let me first describe a little bit what anthropology is. And it really is about human society and how we interact in that society, what we think about, let's say, economy or class or religion, even how we build languages, how we see the world around us, different cultural behavior. All those things constitute what we are as social beings, because that's what we are. We are social beings, and everyone is different. So it's you think and behave differently depending on if you're a man or a woman or a boy or a girl or an old woman or a young boy. Very different in the way that they approach the world, the way that they evaluate the world around them, and the way they understand things. So in helping government to formulate messages, to get out, reach the people, as a group, you can't have one message, because that one message will be interpreted in so many different ways and understood in so many different ways that they might not be understood in the way that the government would like it to be understood. So it's really important to have messages that are crafted so that different groups in society can actually understand it. And obviously in this COVID times and now with the vaccinations coming on, we have to have different messages, for example, to those elderly who will eventually be the first group to be vaccinated. We need to have another message for health people, those who work in the health sector, medical staff, because they have another scientific background, but they also have a lot of buzz in terms of social media information and sometimes misinformation as well, that needs to be counteracted. And old people might have a lot of kind of inheritance from the Soviet Union time, when public health services were not what they are now, and they're still basing their understanding and reactions on what was then and not what is now. So it is really important to have social scientists, behavioral scientists, or anthropologists, if you like, to explain and be there to help government understand which different groups they're actually dealing with and which different interpretations they will have from their messages.
Interesting. As a member of the governmental team, I always confront with the question: is there any leadership in this or other government there to cope with all the problems? So the lack of leadership is something we hear every now and then. And indeed, we all were caught by surprise. And you said that people react differently to what governments suggest. So what are those lessons governments all around the world can take from their own societies and other nations' reaction to those restrictive measures, to the need of vaccination? What are those international differences, and what can governments learn from people's reaction?
Well, I mean, you're saying that we have had different approaches. There is no one approach in the world. You know, some countries have been extremely tough on closing down and putting entire populations in quarantine. And of course, the first thing you would think of is China, and then, but also other countries that have more authoritarian regimes like Vietnam were able to basically just close down their countries. And in that way, stopping all social interaction and stopping the virus from spreading. But in societies where people are allowed their own mind, so to speak, it is more difficult to commandeer people to do things. And even though a country might have a strong leadership, it's going to take a lot of persuasion, and people are still going to find their own way. So let me take my own country as an example, Sweden, where there is a trust in government. There's not a kind of looking up to the one leader. It's not really like that, but it's government as a whole. And there were different reactions. Some people were very loyal to the recommendations and the directions that government gave, and some people opposed it and said, some people said it should be much more than what government is recommending, and some people said, I don't give a damn about this. I'm going to do what I want. I'm going to continue partying and traveling and all of that. So this has been a challenge for the world, and I'm not going to say that any country has done it better than any other country, because it's caught us all in the shower, so to speak. The unpreparedness is what is daunting in all of this. Scientists have been saying for years, the big pandemic is coming, and yet governments all around the world ignored this and have not prepared. They might have prepared for a war, which is very different from a pandemic. Most governments, if not all, were caught unaware, unprepared, and so therefore we have very different approaches to how governments have reacted, but also how people have reacted.
That's a perfect bridge to my next question. We started talking about the problems or failures. Let's look at success and failures from three different perspectives: international, governmental or country-related, and individual. So, what is the success of the international response to the pandemics, and what has been made incorrectly?
Well, I think, to the pandemic, I think the international response, for example, to agree to restrict travel, to agree to close borders. I mean, no one has sort of declared war on another nation because they've closed the borders. It's been, okay, we understand why you're doing this. So there's been an understanding of each other's reactions and actions. So that is I think, a step forward in a way, in many ways, in the relationship between nations. And internationally, I think it's been a success that there has been increasingly an understanding that children, and now of course I speak from a UNICEF perspective, are not necessarily to blame for this, if anyone, to blame for the pandemic. They are usually not the largest spreader of the virus, and therefore should be allowed to continue schooling. In the beginning, it was lots of countries closed down education. We cannot have that. Children had to stay at home. And it caused a lot of stress, a lot of economic stress, but also a lot of stress on future education capabilities of children. And so now, most countries in the world have realized schools can be open, at least for primary school. It's okay. We're not going to harm society by doing that. In fact, we're improving children's lives. So there are things like that that have been internationally shared experiences. First, the reaction is always, let's be as tough as possible. And then we learn and then we relax and allow those things that we can see work. And education for primary school children is one of those things that have worked. On an individual level, I think it is a little bit, I think, sometimes disappointing to see that many people have said that, well, I can't be quarantined, I'm not going to stop doing this, and I don't like wearing face masks, why should I be wearing face masks? And even if you don't want to protect yourself, why can you not be in solidarity or compassionate enough to protect others? Because older people are more susceptible. They will get sicker. People with comorbidities that you might not even see when you meet someone in the street, but it's there, they might become severely sick and die. And so that lack of compassion, there's so small things that you need to do to actually protect others, never mind yourself.
Let's come to this country. You are helping as a representative of United Nations Children's Fund to shape response of this country to the pandemics. Is there something you are really proud of what this government did? Is there something that you think you would have done it differently?
I'm proud that the government reacted so quickly in March. The lockdown. I think that was
borders.
Yes, I think that was a really good and important thing, and it did help. After that, maybe people became a little bit too relaxed, in my opinion, but the initial lockdown was very, very helpful. So that I'm proud of. I'm also, we are now involved in the whole setup of the vaccination of the entire population eventually. And I am also seeing a lot of energy, determination from the government, even from the top, from the president, now wanting to have a national dialogue where the one message is, go and get vaccinated, because that's the only thing that's going to stop this now. We should continue wearing masks, washing our hands, and keep a physical distance. I'm not going to call it social distance, physical distance. But the vaccine is really going to be eventually, not this year, but in a few years, having stopped the COVID-19 pandemic.
Yeah. Earlier this day, from this podium, we heard that this pandemics would not change the world and would not change people's behavior that much as it was said before. Earlier in December, and coming back to diplomacy, the Politica newspaper came with an article titled Year 2020, the year the diplomacy died. Don't you think that we will never see each other traveling abroad, and the new generations of diplomats would easily refuse from people-to-people meetings and go through VTC, just not spending money for flights overseas and not just going against the nature, trying to preserve resources just by staying home?
I think we will do a lot more using sort of online methods of Zoom or wherever you call it to meet. But I think that face-to-face meeting is never going to be replaced, and especially when it comes to diplomacy, because it's so much about understanding the person that you are dealing with, that you're negotiating with. And it's really hard to do that if you look at someone in a screen. And we know that from experience, that meeting between two individuals, two world leaders or two politicians or diplomats really has to. So I think it'll be much less face-to-face, but I think we will still have it. And you also said, the article from Politica said that diplomacy has died. I don't agree with that. I think it has changed, but I think something remarkable happened last year in diplomacy, and that's something called COVAX. And COVAX is an initiative that was initiated by the UN, I will admit that, but it is an initiative to equalize the distribution of vaccines all over the world. And basically, governments and private companies like Pfizer and AstraZeneca and others have agreed through this COVAX initiative that distribution of vaccines will be equitable. And so that unified agreement between 3 different parties basically have come to be thanks to this UN-initiated initiative. And that's unique. I mean, private sectors never before agreed, yes, we will deal with this equitably. We will not give vaccines to the one who pays first and most. We will do that also, but we will make sure that part of what we produce will actually go to the poorest countries, those who have less resources, those who are not able to pay fast, much and quick, you know. So I think that's a huge success for diplomacy. It was not something that the UN decided or Pfizer decided or a government decided. It was everyone coming together and saying we need to do this because otherwise we'll never stop the pandemic.
Your message is you can trust the diplomats.
Well, my message is that diplomacy can be successful, very successful.
And we will contribute to the issue that it is successful.
Yes.
You just told about the need to get your vaccination. So this is your message to the people: get your vaccine. And UNICEF is doing a lot to spread that message across the country. Myself, I also participated some of the events. And I think you would agree, the more the politicians, the governmental institutions, the opinion leaders would give an example of a responsible citizen that would bring this country to success. And time and again, we realize the importance of communications, the importance of those 3 words, sound bites like wash your hands, keep your distance, go get vaccine. What would be your proposals? What messages would you give to Ukrainians and to our audience?
Well, apart from, of course, making sure that you yourself and your families, and especially, of course, those elderly in your family, get vaccinated as soon as possible, as soon as the vaccines are available. Apart from that, I think the compassion that we need to show. And a lot of people, and not only old people, but a lot of people have been left alone, feeling socially isolated, feeling, you know, they not only have they lost their jobs, etc., they can't see their families, or maybe their most important social contact is actually at work, and they don't have that anymore because they have to work from home. And so I think showing people more tolerance, be more caring, call up people, even call up people you don't know that well, just asking how they are. And especially if you know that they are alone and lonely, possibly. I think that would be a huge, huge favor to a lot of people in this country.
And let me add at the end just one word, one very important word, is the word thank you. Thank you, Lotta, for sharing your insights. Thanks to the audience for being with us. And please join us in using those magic words, thank you, more often. First of all, to those who care for us. To doctors, nurses, social workers. Thank you for saving our lives. Thank you for caring for us. Thank you for keeping us healthy. Merci beaucoup. Tak.